Hari Prakash sir. He is an eminent guest, and I also welcome Dr. Shashwat sir.
Thank you.
Yeah. Now it's visible, Hari sir.
Yeah, okay. So you want me to go ahead?
Again, a warm welcome to both our today's eminent speakers, Dr. Hari Prakash sir and Dr. Shashwat sir.
Thank you, sir.
We are fortunate today to
Thank
have
you.
one but two guest faculty today to enlighten us on the knowledge on child health and not just child health but also vaccination part of child health. So we are lucky to have you guys, sir. And just to give a brief background to this today's session, I would like to share one thought. There is one quote which says that bright futures begin with healthy babies. And when this reality is ignored, it begins a long line of social and economic failures that strain parents, families, communities, and the overall health and economic stability of the entire population. So, with that thought, I would like to emphasize on the importance of today's session and what Sir will be teaching us regarding the various child health programs, and then we'll take to the next session where Shashwat Sir will be enlightening us on the various vaccination programs pertaining to child health and their correlation maybe with the present scenario of COVID pandemic. So, just to give a brief introduction of our eminent guest today. We have in the first session today Dr. Hari Prakash. He is an MBBS and MPH scholar, and he had been a district program coordinator in Narmada district. He had been maternal and child health consultant with Government of India, and he is currently serving as UNICEF consultant as a newborn care consultant. So I welcome you, sir, in this webinar. Our next guest today is Dr. Shashwat. He is our respected senior. We all know him, and he's an expert in the field as well. He has some more than 10 years of experience in the core domain, in which he has worked 4 years at the grassroots level with UNICEF and as a UNICEF consultant. He is also a Gujarat level trainer for routine immunization, cold chain, and IMNCI. So, with that note, I welcome both of our guests today.
Thank you.
I would also like to emphasize on the few facts and figures I have with me related to today's session. Just to emphasize more on the session of child health various programs. In India, we have live births of 20.2 per thousand population, and a death rate of 6.3 child per thousand population, and we have an infant mortality rate of 33 per thousand live births, which has gone down significantly from since the post-colonization era and since 1990s and then the start of the next decade, and now we have a IMR of 33. So as far as India is concerned, we are doing significantly well, and needless to say, with the help of our development partners, UNICEF and WHO and all the other UN agencies and other international, national, local NGOs who are working blood and sweat to reduce the this crucial public health issue of maternal and child health, and doing a great contribution for the society. So with that note, I would like to hand over this session to Dr. Hari Prakash. Sir, please take over the session and guide us for the various national health programs pertaining to child health.
Thank you very much. Thank you for the very nice introduction. I would like to begin with where you left. You said the future of the nation lies with healthy baby. I would emphasize more on it, and I would say that future of healthy baby lies within healthy brain. So that is what I'm going to discuss today. Basically, early childhood development, and I will touch a little bit upon child health programs, but I would focus more on early childhood development. That is a new upcoming concept. We call it. We also call it journey of the first 1,000 days approach. And government of India has released a guideline for the parents on the journey of first 1,000 days, and based on that, government of Gujarat has come up with a couple of other guidelines that focuses on changes or interventions required in health facilities, institutes, in order to ensure that the institute is compliant with first 1,000 days approach. Likewise, we have come up with guidelines on first 1,000 days for the community level also. For example, if ASHA or any frontline health worker visits the community or house of the beneficiary, what are the interventions that helps in early childhood development? So we have come up with a couple of guidelines, messages, and ICBCC materials. So that is what we have done so far. But coming back to the topic of journey of first 1,000 days or early childhood development, let's just understand what is this first 1,000 days approach. Uh, yeah, uh, if you look at the slide, what we have shown here is the weight of the brain at the time of birth of different species or different animals. For human beings, when a baby is born, his or her brain weight is only 25% of adult size. The size of the brain is only 25% of the adult size. While in case of chimpanzee, it is around 45%, and for in case of cattle, it's more than 80 or 90%. So what we need to understand is 75% of development of the brain occurs after the birth. So it becomes critical to look after the baby after birth. The environment that we provide, the nutrition that we provide, the love, care that we provide shapes the entire aspect of the brain development and the intelligence of the baby. So we call this approach the first 1,000 days. It we say it helps in cognitive development of the baby or intelligence of the baby. So what is this first 1,000 days? It starts. We have Dr. Arun Singh. He is a national advisor, Rashtriya Bal Swasthya Karyakram with the Ministry of Health and Family Welfare at New Delhi. He calls or he explains first 1,000 days or early childhood development starts when women thinks of having a baby. This is not the exact definition, but what he meant is when women start thinking about having a baby, she should start adopting behavior in a way that helps in a early childhood development or development of the brain. So first 1,000 days consist of from the conception to pregnancy, that is around 270 days, and the first year of life of the baby, that is 365 days, and the second year of life of baby, that is again 365 days. So from conception to pregnancy, that is 270 days plus first year, and second year 365 plus 365 days. So that is total first 1,000 days. So why it is so much important? As I already said, that 75% brain development occurs during this first 1,000 days. So that is why it holds a key for the entire intelligence or smartness of the baby. So here again we can see that during birth it is 25. The size of the brain is 25%. Around 7 years or 5 to 7 years, it is 92 to 95%. But when you see around 3 years, it is 85%. So the maximum development of the brain occurs during first 2 to 3 years. So it makes sense to focus on baby's development during first 1,000 days or early childhood. Let me give a little bit of comparison with what we have, what we have developed in terms of roads and infrastructure. We have developed Ahmedabad Baroda Expressway. Now, anybody who has traveled before the development of the expressway would remember how difficult was it to travel from Ahmedabad to Baroda and back to Ahmedabad. So, once we have developed this expressway, it has reduced time, it has increased the safety, and it has developed in all. It has helped in overall development of the Ahmedabad and Baroda city and other cities in nearby areas because of the speed and safety. Now, similar things happens in the brain during early childhood or during first 1,000 days. There are crores of neurons, millions of neurons develop, and these neurons connect with each other. Just to give you a hint, every second, 15,000 neurons connect with each other, and there are millions of neurons developed during these first 1,000 days. Once these neurons develop, once they have established connections, then it is there for the entire life, except pruning of several neurons, which are not required for the process. But mostly, once these neurons and once these connections are developed, it is there for the entire life of the baby. So that is why it is really, you can see the slide there during 36 weeks of gestation, there are only few neurons and there are only few connections. When the baby is born and 3 months, and 6 months, and 2 years, and later on, these neurons and connections increases with a rapid speed. It's like exponential growth. So, so that is why it becomes critical. It becomes critical to focus on first 1,000 days approach. And we have a couple of study also available that says that if baby is born before 35 weeks or before 37 weeks, there are higher chances of developing behavior problems in the baby. So that is why it is also critical that baby is born after 39 completed weeks. Uh, Now here we are trying to explain that when we talk about 1,000 days, we talk about development of brain. So we have two factors. One is genetics and one is environment. Now, there is a study done by one of the famous scientists or economist in USA, Dr. Gluckman. Dr. Gluckman, he says that genetics only plays 20% part in baby's brain development, while 80% of brain is affected, or development of 80% of the brain is affected by environment that we give, the nutrition that we provide, the love that we give. So that is why it becomes imperative to look after baby during this first 1,000 days approach. And there is a clear cut. I mean, since Dr. Gluckman, being economist, he came up with a comparison that if you spend $1 during early part of childhood development, you get return of $48. That is huge. Now, if you compare that with the current scenario, and you think when we spend largest amount of money for the career of our children, you might come up with idea that we spend largest amount during college period, or during graduation. But what we need to do is we need to spend largest amount of money during this first 1,000 days of childhood development. Now I know like a couple of studies that that help us to understand why it is important to focus during first 1,000 days. Now here in this graph, uh, we have on one side the age in years, and the on the other side the language understanding the new language. You can see that during first 3 to 7 years, the ability to understand new language is very high, and then it gradually comes down. So there is an Institute of Learning and Brain Development in University of Washington, and it is run by Dr. Patricia Kuhl. They have come up with various experiment, and a couple of these experiments are really interesting. What they have done is they have exposed newborn babies during initial period of their life to various languages, and they have tried to understand when it is most important for the children to expose to the other languages, when it is easy for the children to pick up other languages. So what they have understood is the period before 6 to 8 months is critical. Something happens after 8 to 10 months, then children lose the grasp of understanding new languages. So our when we talk with the children, when we interact with them, we usually think that they are very young, they are small, their brain is not developed, so they do not understand what we are speaking. But this experiment clearly showed that during initial period of before 6 to 8 months, they have very high capacity of picking up new languages. But important part here is this new language cannot be taught in the form of video lecture or audio lecture. What we need is a person or native person who speaks that languages. So one critical factor comes up here is the interaction, the physical interaction is critical in understanding new languages. So it is really easy to so it becomes imperative that we talk with the children, we interact with them during early part of the childhood.
Hari sir,
Yes.
sorry to interrupt you. I'm very
Uh,
sorry, but many of our viewers are not able to see the presentation, which the
right,
slide that we are sharing.
right.
So, will it be possible, sir, if you can stop sharing the presentation and reshare it?
Yeah, yeah, sure. Let me do that again. Yeah,
Thank you
yeah.
so much.
Uh, is it visible? You can let me know when.
Not yet, sir.
Or what I think is, slides are not that important in this discussion. So I can share it later on with you, and you can share it with the group. So only I can go ahead with the our talk, and that will also helps to understand what we need. About this approach. I mean, that is fine.
Yeah, sure, sir. But just for a moment of couple of seconds, it was visible, and now it has gone again. So,
Uh, I don't know. Maybe network issues.
yeah, no issue, sir. You can please proceed, sir.
Yeah. Let me go ahead with the talk. Yeah. So, so then there was another study that was conducted with University of Kansas. This study is really interesting. What they have done is they have picked up children of three years of age from two different groups. One group was from the rich family with lots of money. And the another group is the poor family without, with less money. And then what they have done is they have tried to understand how many words their children could speak at the age of 3. So there was clear cut difference. The children from the rich family could speak number, the large number of words. They could speak almost double number of words than what the children from the poor family could speak. So what they have done is then they have tried to identify what are the important factors. So they have come up with the two important factors. One is the availability of toys in the family, and second is the interaction with the baby. So they have clearly said that the availability of toys in the family and interaction and the way we interact, the time we give to the children, it helps in the development of the brain in terms of like language and like learning, listening, and speaking. So likewise, there are many other studies. All of them clearly says that what we understand about the children, about the early childhood development, is what it's not reality. There is something more. Children can understand. Children can talk. Children can develop understanding at very early age. What we need is to provide a right environment with appropriate nutrition. So, so coming back to the first 1,000 days, is there are a couple of principles of first 1,000 days approach. The first principle is any child can become intelligent provided that parents are ready to give sufficient time and energy. Again, I am repeating, any child can become intelligent provided that parents are ready to give sufficient time and energy. That is the first principle of first 1,000 days approach or early childhood development. The second principle is we need to provide three things: proper environment, proper stimulation, and proper nutrition. Only three things we need to provide a proper environment, stimulation, and nutrition. Now let's understand each of these components one by one. So when we say about proper environment, let us try to understand when child is within the womb. I'm sorry, fetus is within the womb. He's he's getting nutrition from the umbilical cord. He is protected from all kind of obnoxious stimuli or toxic stimuli or the toxic environment. He's protected from everywhere. He's in the warm amniotic fluid. Now that child comes out after birth, he gets exposed to all kind of toxic stimuli that he was not exposed earlier. So that affects his brain development. So what we need to do is we need to as soon as child is born, we need to put him or her onto the abdomen of the mother, dry a little bit, and put him or her onto the breast immediately. When the child starts suckling the breast, he gets milk. So there are two components here. There are two important components. One, child gets warmth of the mother, so he doesn't develop hypothermia. Child gets milk. Newborn baby gets milk, so he doesn't develop hypoglycemia. And also he is in a skin to skin contact with the mother. He is also looking at the mother. He or she is getting smell of mother, and also mother is also looking at her, talking at her if possible. So ensure that this baby that you are safe, you are with me. This is really important. I mean, mother need to touch the baby, caress the baby, provide immediate breastfeeding, and put baby into skin to skin care. So whatever baby was getting inside the womb, now she is getting outside the womb also. So that warmth, that comfort, helps the development of the baby's brain. Now, another thing is as of current uh, as of current guideline or current practices, many times we usually cut the cord immediately. The umbilical cord that was providing nutrition to the baby, we cut it immediately. Now we need to understand. Let's understand a couple of things that is important with respect to first 1,000 days approach or the early childhood development. Umbilical cord transfer 80 ml of blood to the baby after baby is born. 80 ml of blood. Now that if you ask any pediatrician, they will tell you that total blood volume of the baby is 250 ml. Now 80 ml of blood is transferred after the baby is born, transferred from placenta through umbilical cord to the baby. That 80 ml forms the 30% of total blood volume, that is 250 ml. Now, if you compare that with the adult, total blood volume in the adult is around 5 liters. Now, 30% of that 5 liter is 1.5 liter. If you remove that 1.5 liter from the adult, it's a shock. Adult may die. Adult can die. I mean, the person can die. Now, similar things happen with a newborn baby. Only thing is we do not notice it. We do not study it. We do not understand it. That 30% or 80 ml of blood loss gives shock-like condition to the baby. And there are a couple of studies available. You can share the reference of a couple of them with the Leiden University. One is from our own Srimad Rajchandra Hospital. That is at Dharampur, Valsad in Gujarat. And we are doing a couple of studies in Rajkot, SSG Hospital, Baroda, and then Surat also. I mean, we're planning to conduct this kind of study. But all of those studies clearly shows that there was shock-like condition if we cut the umbilical cord immediately. And and the another important aspect, let's try to understand. I mean, we have discussed blood. Let's try to understand what happens with the oxygen. When baby was inside the womb, in a fetal condition, he or she was getting oxygen through the umbilical cord. When he or she comes out, he to start breathing from the lungs. Now, this process, we call it extrauterine we call it transition from intrauterine life to extrauterine life, life within the womb to the life outside the womb. We call it the transition. The transition takes some time. It is usually 5 to 7 minutes. Now, what happens is we need to push all the fluid within the alveoli of the lung to outside. So the air can go inside the alveoli and baby can start breathing process, so that oxygen can go from alveoli to the blood and can circulate to the other part of the body. Now, but this process takes some time. It's around 5 to 7 minutes. During this process, we have this umbilical cord attached. It is providing oxygen to the baby. Now, if we cut the umbilical cord immediately, the oxygen suddenly stops. Now, if baby's other way of breathing, that is through the lung, doesn't develop properly, baby may go into birth asphyxia, that is not getting proper oxygen. If baby doesn't get proper oxygen, she or he may immediately suffer brain damage. So, in a way, this is really important to let placenta come out and we do not the umbilical cord. So these are the couple of new developments. And even government of India has issued a guideline that we should not cut the umbilical cord till placenta is out. And there are a couple of studies also that are proving that it is beneficial for the mother as well as baby. So I mean, so this is what about providing proper environment and proper nutrition to the baby. Uh, Likewise, there are a couple of other things. Uh, there is something called flavor breeze concept. This flavor breeze concept says that whatever mother eats during pregnancy, baby develops interest to eat that kind of food once he or she starts eating. Like after 6 to 8 months, baby starts taking food, he or she develops interest of taking that kind of food. This concept is called flavor breeze concept, and it is new concept and very well established also. Even in case of my baby, I experienced the same thing. Whatever my wife used to eat during pregnancy, my baby developed a habit of eating that kind of food. So when we talk about nutrition, now this becomes really important. We need to advise mother to eat healthy foods, to eat fruits, vegetables, and foods that contain micronutrients. So, if mother, I mean pregnant lady eats fruits, baby takes fruits. If pregnant lady takes pizza, baby takes pizza. That's simple. So if with regards to nutrition also, it starts from the antenatal period or the when mother is pregnant. It starts from that period also. Whatever mother eats, maybe it's that thing when he or she starts taking food. Apart from that, we need to take care of babies food or diet in terms of like providing mixture of all kind of foods like vegetable and fruits and like proteins and sufficient amount of calorie. So that is there. But this 1,000 days concept goes in deeper and says that food during antenatal period affects the dietary habit of the baby. So there are many other things like that. So we have talked about like providing proper environment to the baby, providing nutrition. Likewise, let's talk about the stimulation. Uh, Considering like time, it is difficult to explain everything about the 1,000 days. It's a really big concept, and we can go on for days and days to understand this. But I mean, considering the current context, let's understand what is stimulation. So let me let's understand some simple facts. Like if you touch your face, the sensory receptor from that part of the face are stimulated and it transmits signals to the neuron and it goes to the part of the brain that is related to that sensory touch. Now, once that part is stimulated, the brain gets, I mean, sorry, neurons get activated, new neuron grows, it gets connected with each other. So, if you touch the baby, same things happen. If you touch the baby's face, that part of the sensory receptors and gets activated and that transmit the signal to the brain and that part of the brain, gets activated and neurons develop and connections and synapses happens. So that is that simple. So what it tells is we need to keep stimulating the baby in terms of like sensory touch or visual stimulation, sensory stimulation, auditory stimulation. So what we need to do is we need to caress and love the baby. We need to talk with her or him. We need to sing a story. We need to sing a song. We need to tell a story. We need to show baby to the different things. Like even though baby is young, 6 to 8 months, we think that he or she doesn't understand what is there. But it is important that we take the baby to our outside environment. We need to tell the baby that, oh, okay, look there, there is a tree. It has green leaves. This is the fruit, or this is the car, or this is the bird. This is this is that thing. So what I mean is, we need to narrate a story to the baby even though he or she doesn't I mean, we think that he or she doesn't understand, but the part of the brain understand everything what we say. So the early childhood development says that we need to provide a proper environment, proper nutrition, and proper stimulation. So we have come up with the guidelines also, and we have also come up with various messages. Those are like small messages that the messages are important with regards to the beneficiary. Uh, uh, so the first 1,000 days or early childhood development concept tells us that focusing during early childhood development shapes the entire life of the babies, like entire life of the baby in terms of like cognitive development, in terms of the physical development. Now, let's move on to the couple of important childhood health programs with the government. We will not take much time, maybe another 5 to 10 minutes. So, considering this early childhood development, government has come up with several programs at the community level as well as facility level. At community level, we have home-based newborn care (HBNC), home-based newborn care. So, what is that? Our frontline health worker or ASHA, as we call them, or maybe ANM. So, but for the home-based newborn care, ASHA visits home of beneficiary, home of newborn baby for 6 to 7 times during initial 1.5 month of life of baby, and examine the baby, and examine the mother, and interact with the mother and interact with the baby, and try to understand whether baby is developing normally or not. If baby is not developing normally, then the baby, I mean, baby is having any risk factor or diseases, that baby is gets referred. But the important objective of this home-based newborn care is to inculcate, is to develop healthy, healthy habits or healthy practices for mother and a caretaker. So Asha usually look at whether baby is getting proper nutrition, whether the baby, passing stools and urine, whether the mother understand importance of breastfeeding, importance to, take care of the baby, importance of, giving warmth to the baby. So this is home-based newborn care, and that start from birth of the baby and runs on to till 1.5 months of life of the baby. Next program is home-based young child care. So again, it is similar concept. ASHA visits home of the baby, and this program goes from 3 months to 1.5 year of life of baby. So the home-based newborn care was till 1.5 months. Home-based young child care goes up to 1.5 years. Why it is important? Because most of the development of the baby in terms of like walking, in terms of like holding things, in terms of like developing practices to take foods. So this important practices developed during initial 1.5 years. So that is why Asha visits the home of the baby every 3 months, every quarter. So third months of life of baby, 6 months, 9 months, 12 months, and then 15 months. And again, look at babies from the perspective of physical development, mental development, and whether baby is getting sufficient nutrition. And if there are any issues, then that baby is referred to primary health center or nearby government or private hospitals. So this home-based young child care runs from 3 months of the life of the baby to 1.5 year of life of the baby. And ASHA gets incentive for each of these visits. Likewise, we have so these are the community-based program. We have a couple of other community-based program also, like intensified diarrhea control fortnight. That is related to identification and management of childhood diarrheal diseases. So here, Asha again, just before monsoon months, I mean pre-monsoon, around like May or June, visits home of each and every under 5 children and distribute ORS packet, and also explain about use of ORS packet, hand washing, and nutrition. So during monsoon, if baby develops diarrhea, then caretaker or guardians can easily give ORS packets and take care of diarrhea. So that is intensified diarrhea control fortnight. That is usually in campaign mode during pre-monsoon months, usually May to June, and this is only for 15 days. So likewise, there are a couple of other programs that is coming up. one program is SARS, that is for childhood pneumonia management. Here, usually community worker like ASHA or ANM identify child with childhood pneumonia and try to manage it possible at home or a sub-center, or otherwise refer child to the primary health center or other government or private hospital based on severity or condition. Likewise, we have a couple of facility-based program also. We have established 48 special newborn care unit. That is the newborn care unit to take care of high-risk baby with the diseases like birth asphyxia or respiratory syndrome, respiratory diseases, or like hypoglycemia or hypothermia or other critical conditions. So in the Gujarat, we have established 48 special newborn care unit. Across India, we have established around more than 700 special newborn care units. These are usually units with 10 to 12 beds or radiant warmers, with phototherapy units, and with trained staff in taking care of newborn babies. That is the facility-based newborn care training of around 4 days classroom and 15 days of observership at the training center or the special newborn care unit. So, so this offensive concept basically takes care of the babies, sick and small babies who require support in terms of antibiotic or critical care in terms of like ventilator support or CPAP support. Likewise, we have established newborn stabilization unit, that is NBSU at FRU level, first referral unit or community health center level. So this newborn stabilization units helps in initial stabilization of the baby and peripheral area in the peripheral area where special newborn care units are not available. It is equipped with around four staff nurses and one to two medical officers and a pediatrician wherever available, and they are usually trained with the special training. Likewise, we have newborn care corner at all delivery points. That is to take care of the baby immediately after birth in terms of like, providing essential newborn care, in terms of providing initial resuscitation if baby is not able to breathe normally or baby develops birth asphyxia or other similar conditions. So we have established newborn care corner at all delivery points. Likewise, whenever baby graduates or discharges from the special newborn care units, uh, that baby is followed up at a facility level and at a community level for around 5 to 6 times. At a community level, baby is followed up at home by ASHA. At the facility level, baby is followed up in a neurodevelopmental clinic. This clinic is usually run by pediatricians to look after the baby. So and likewise, we are trying to deploy neonatal ambulance to strengthen the referral. Currently, baby is referred in GVK MD 108 ambulances, but we are planning to deploy neonatal ambulances with the specially trained staff. Likewise, we have one important scheme from government of Gujarat. This is specific to government of Gujarat. This scheme is called Bal Sakha Yojana 3, where we have MOU with the private practitioner or private pediatricians or the hospital with private pediatrician to take care of the small and sick newborn babies. And the entire cost is borne by government. Beneficiary doesn't have to pay anything. So this is brief about early childhood development or first 1,000 days approach and childhood programs run by government of India and government of Gujarat. So with this, I stop here and hand over to the moderator. Thank you.
Thank you so much, Hari Prakash sir, for such a wonderful deliberation, comprehensive deliberation on the various measures of child care. And you rightly, very precisely mentioned about the the importance of first 1,000 days, which I feel personally is also a very significant aspect of a child care, not just in terms of physical growth, but also in terms of mental growth. And this is the period where which begins not just from after the birth of a child, but since the it begins with the pregnancy planning, and it continues till the child, if I'm not wrong, till the child gets the age of 2 years.
Right.
And this entire journey is each day of this entire journey is significant in its own way, in order for the child to become a for the growth and for the better development of the baby. So thank you so much, sir. It was a wonderful session, and I'll request my audience to please bear with us and keep your questions and queries parked till the end of the session. And may I request Shashwat sir now to take over the session and help us understand the aspects of immunization, which is equally a significant part, especially in Indian context, where there are lot many vaccine preventable deaths are occurring, and such vaccination and the emphasis on immunization will can significantly reduce the IMR within our country. So Shashwat sir, the session is over to you.
Yeah. So, good morning, everybody, and good to see you all. And I'm sure everyone is feeling energized and enriched with the knowledge provided by Dr. Hari on the early childhood development and the journey of first 1,000 days. It was an excellent session. So, if you all can see the slides, then I'll start presenting.
Yes, sir. The slide.
Yeah, go ahead. Thank you.
Okay. Okay.
Thank you, sir.
Yeah, thank you, sir. So, first of all, as we all know, that immunization is one of the most cost-effective and important public health interventions that we talk about when we talk about public health interventions for control of health problems and morbidities and mortalities. And we have had a very successful and long-running immunization program. In fact, if you see the global health, it was one of the oldest things that developed as a public health intervention to prevent and control diseases. And this is something which went as early as the late 1700s when the first vaccine got discovered by Sir Edward Jenner, one of the most famous scientists from the public health history, where he discovered immunization for smallpox. And since then, I think there has been no looking back. And there have been so many vaccines that have been introduced, there have been so many programs that have been running, and so many parallel systems also that has been supporting the government and the international agencies on the impactful immunization for prevention of childhood diseases. In fact, if you see one of the most important targets or goals which we all the countries across the world stated to achieve was to reach the sustainable development goals by 2030. And out of that, one of the most important targets was reduction of under 5 mortality to 25 per 1,000 live births. And this was one of the most important targets for countries across the world. And if you see, there was a significant progress as well. Comparing the situation before COVID-19, we had almost 60 million deaths of under 5 children from preventable causes way back in 1994, and that improved to almost 25 million preventable deaths of under 5 children. So there was a significant 50 to 60% improvement, and everything was going quite good. But then came in COVID-19 towards the end of 2019, and I will say that there has been a major, or I will say there has been a deep impact of this pandemic on health services in general, and not just the immunization services. So much so that it is difficult to identify, and it will take some time for us to assess and analyze as to where do we stand now and how much needs to be improved and changed, right? So this is something which has to be taken care of. And there have been surveys that have been carried out to assess the impact of the pandemic on the health services. And one of such surveys that was carried out by UNICEF a couple of months ago stated that almost 70 percentage of the countries, it surveyed a total of 77 countries, and 70 percentage of such countries were affected or deeply impacted and even jolted by the pandemic, and the services, health services, including immunization, were shaken up, and they were deeply impacted by the pandemic. So this clearly shows that there has been a significant impact. If you see that the people are not going to the hospitals to seek the treatment, the antenatal mothers are the proportion of institutional deliveries and seeking healthcare during the antenatal period is also reduced. Children have not been taken by their parents to the clinics or hospitals or nursing homes to seek the treatment or go for routine immunization sessions. And if this continues for long, and this pandemic, honestly speaking, doesn't look as towards its end in near future, and it has been estimated by the Johns Hopkins University that if this continues, then we'll have additional 6 to 10,000 deaths for every country every year from the preventable causes of childhood mortality. So we have to focus on these aspects and look where we can go from here and how we can get the services back on track, right? And immunization services have to focus on the dropped out and left out children. We just cannot start from where we stopped. So we have to look at how many children we missed, how many children got dropped out, and how we can focus and improve that. So let us start with some of the basics. As we know, immunization is like one of the most important interventions and one of the longest running programs. And even for that aspect, the Universal Immunization Program for India is one of the oldest running programs and covers around 2.7 crore newborns, 10 crore under 5 children, and about 30 million pregnant women each year. So these are big numbers, significant numbers. And during the lockdown and post-lockdown, during the unlock period, as we have not had a complete unlock and the services have not got on track, we still do not know how many children we have missed and how many children need to be covered. So this is something which is very important. If you see the history of the immunization program, we started with a simple universal immunization program which got launched in the early 1980s, and then later on which got merged with the Child Survival and Safe Motherhood, and later on with the National Health Mission, and now one of the most important programs and commonly reviewed programs for the government of India. The current immunization program that we have has got a large set of vaccines which cover many diseases. In fact, when we started, we had only vaccines to cover 6 major diseases, but over a period of time, this has expanded. And now we have vaccines which cover almost 13 diseases, which include childhood tuberculosis, diphtheria, pertussis, tetanus, poliomyelitis, measles, hepatitis B, acute diarrheal diseases, Japanese encephalitis in the endemic areas, rubella, pneumonia, and pneumococcal diseases, and rotavirus. So this shows that there has been uh, many number of diseases which the immunization program has covered. And we have also, not to forget, parallel immunization systems running. So we have the UIP set of vaccines which are provided by the government. And then we also have immunizations running in the private setups, which are provided by the pediatricians, which work under the IAP schedule, where you have additional protection given by several other vaccines like meningococcal or other vaccines which are existent. So this is something which is just as a backdrop of what the situation is. And looking at the immunization status and the national immunization schedule, we have some of the primary set of vaccines which are given during the first year of life, out of which 3 main vaccines which are given at birth. And these vaccines include BCG, hepatitis B, and oral polio, right? We should also keep in mind the maximum age at which these vaccines can be given, so that this is something which is extremely relevant and contemporary during the current scenario where we do not exactly know how many children we have missed out, and we need to cover all of them. So if we know the maximum age till which these vaccines can be given, we can cover them up easily, right? And then we have the primary set of vaccines which start at 6, 10, and 14 weeks, which includes oral polio vaccine, pentavalent vaccine, and fractional IPV, which got started, and it is given at 6 and 14 weeks. And then, of course, the rotavirus vaccine, which is given at 6 and 14 weeks. We also have the pneumococcal conjugate vaccine, which is introduced in some parts of the country and is not scaled up for the entire country, but in most of the states it is covered. And then we have measles and vitamin A at 9 months of age.
Japanese encephalitis is one such vaccine which is given primarily in the areas which are endemic for that particular disease, and that includes the northern and the eastern states of India, and it is not something which is covered in the state of Gujarat. Going further, on the second year of life, we have had immunization for the booster vaccines or the additional doses of the vaccines which we give, like we give measles at 16 to 24 months, and booster doses of DPT and OPV. And then finally, the second booster of DPT, which is given at 5 to 6 years of age, and TT, which used to be given previously, is now replaced by DT. So you can see this is a merry picture which helps you to remember all the vaccines, right, starting right from the birth up to the time that a mother becomes pregnant during the antenatal period. The number of vaccines have increased quite a bit. So this shows that the government commitment is quite high in preventing the vaccine preventable diseases and deaths which are preventable. So immunization is one of the most important programs that has to be followed well to ensure that the number of deaths keep reducing and we reach towards the sustainable goal targets. If you see the recent advances, the data have improved quite a bit with respect to the maternal mortality. India has reached 113 per 1 lakh live births. And in terms of the infant mortality rate, we are at about 32, right? And considering the fact that in terms of the neonatal mortality also there has been a significant progress. So all the interventions, in fact all the programs that Dr. Hari talked about, and interventions which are evidence based, their immunization plays a very critical role. This is a slide which shows the impact of universal immunization program over the years, as we see that smallpox and polio are two diseases which have been either eradicated or they are near eradication, and the other diseases which have had a significant reduction. Significant means 80% reduction in the number of cases. Now this is big. If you have interventions which can reduce the morbidities up to 80 to 90 percentage and significant reduction in the number of deaths, then I think this is a very, very important, impactful intervention which should continue in future. Over the last 1 decade, if you see in terms of immunization, as I said, there have been a lot of newer vaccines that have developed. And it is also important that every year, almost every year, if you see, the newer vaccines have been introduced. And there have been evidence-based interventions also with respect to the change from the trivalent to the bivalent vaccine, and change from full IPV into a fractional dose of IPV, and so on. And we have reached to significant milestones like the regional eradication of poliomyelitis from our region and neonatal tetanus elimination from India. So these are significant measurable outcomes which we have achieved. Now, talking about the immunization coverage levels, over a period of years, there have been a significant but steady increase in the immunization coverage level. Seeing from the level of 2005, there has been almost a 20% rise in the total immunization coverage level. So this is good news. But even though the increase in the immunization levels have been there, it is not to as high level as we would want it to achieve. So, over a couple of years back, we had the target of achieving full immunization coverage levels by 2020. It is difficult to achieve that if we continue with the same progress. And then in came in the COVID-19 during 2019, and we have had a significant jolt and we have gone back. So, in order to achieve this progress or even sustain or continue the same, we have to make significant progress and achievements. If you see the surveys and compare the data of Gujarat and India, both have not had a very significant rise. And that shows that over the last 5-10 years, we need proper interventions and tracking of the children and the pregnant women to ensure that all the primary set of vaccines and the booster doses are continued. One of the recent surveys after introduction of Mission Indradhanush. Now, Mission Indradhanush is one such program which was launched in 2014 by Government of India to ensure that all the dropped out and left out children are covered for immunization services. I hope all of you know what is dropped out and left out. Dropped out children are those children which have had some sort of a contact with the immunization system but have not completed the minimum stated vaccines for that particular age. And left out children are those children who have not come at all in contact with the health system and have not even taken the primary set of vaccines. So the dropped out and the left out children need to be mapped, they need to be enlisted, and they need to be covered ideally in every session. But if we are not able to do that, then it is important that we need to initiate special drives to be able to cover them. And that is what we did in Mission Indradhanush. So we had multiple rounds of Mission Indradhanush starting from 2014, and Mission Indradhanush and intensified Mission Indradhanush. The intensified version focused on those states which were primarily contributing to poor immunization coverage levels. And we have seen that the coverage levels have reached right up to 70%. So this was very good news before the start of the pandemic, and we are progressing in the right direction to achieve the target of 90% immunization coverage by 2018 or 2020. Now, of course, we need to work further for the next couple of years to be able to reach that level. And this data was a recent one that came from the Integrated Child Health and Immunization Survey conducted by the Government of India. Now, just as I discussed, the COVID-19 has had a significant impact on the health services also, and it has literally tested our health system. Ideally, pandemic preparedness should be such that it should not affect other health services. So, if there is a pandemic going on, there should be sufficient resources or sufficient uh, energies in the health system, well structured within the health system to be able to take care of the pandemic, and so much so that the other health systems are not affected. But we've had such an impact that most of the resources, whether you talk about the human resource or the equipments or the money or budget that has been focused towards COVID-19 pandemic, and rightly so, because of the impact of the pandemic in terms of the number of deaths and the number of cases, the other health systems have somewhat got disrupted. And this has led to a slower pace of achievement of the goals of the sustainable development. And immunization is one such program which has been very deeply impacted because it deals with the gathering of the people and contact of the people with the health system. If you see the impact of COVID-19 on the health systems, there has been a problem with both the supply chain and the demand of the services. Supply chain is something which develops from the health system, and demand of the services is something which comes from the people, right, from the beneficiaries. So both of them have got significantly affected, and you can see that in terms of the supply chain or human resource or deployment of the healthcare forces, most of the forces have been directed towards the control of the pandemic. And in terms of the demand of the services, not only there have been a significant jolt over the economical services, but the movement restrictions that have been quite significant in the urban as well as the rural areas, and the concerns with the transmission has reduced the contact between the health system and the population. So there's a significant bridge now that has or a gap that has developed, and we need to bridge that gap in order to make sure that the services are improved. If you see some of the impacts of COVID-19 on most of the health systems, including malnutrition, or whether you take the antenatal care or healthcare utilization of the people and the psychiatric support, the supply chain system with respect to TB, HIV, most of the programs in the health system have got impacted. In fact, if you see, most of the people are staying at home and they are not going to the health services or health centers even for the essential services, and immunization is quite critically one of the most important ones, right? And this has now started getting reflected in some of the vaccine preventable disease outbreaks that have been reported, or sometimes they remain unreported in certain parts of the country. And we also know that the polio vaccination campaigns got cancelled and the measles immunization campaigns have been reduced. So there are a lot of children who are still left unprotected, and they are now vulnerable and they are susceptible towards these diseases. So we are increasing the chances of such outbreaks developing in future. In fact, one of the surveys carried out by the World Health Organization suggested that, which was called as the WHO Pulse Survey in June 2020, that about 82 countries have had some disruption or the other in the immunization services, right? And some of them have had the coverage levels below 80%. Imagine if in our country, if the immunization coverage level goes below 80%, all the hard work that we did during Mission Indradhanush or during the measles catch-up campaign is all nullified, because again we have now a large cohort of children who are unvaccinated and who have not received their primary set of vaccines. and the dropped out and the left out children proportion is growing day by day. So we do not want to reach to a level from which we cannot come back, and that is why it is very important that we resume the services, because as the pandemic does not seem like it is going to end in near future, we cannot wait for the pandemic to settle down for another 1 or 2 years and then we try to get things back on track. It will probably be very late, right? And therefore WHO gave out an advisory, and this advisory focused on how we can get things back on track. So the first and most important thing is to get immunization prioritized. So we cannot let immunization be low on priority. So the health systems start to accord it a top priority, and then start to evaluate the program as and when needed, so that the immunization services start getting back on track, and the people, the stakeholders, like the female health workers or the medical officers, tend to realize that okay, we need to start the immunization services to be able to deal with the situation and getting things back on track. Secondly, VPD surveillance is something which has almost stopped, and VPD surveillance is extremely critical because if the VPD outbreaks are repeated, just to specify, VPD stands for vaccine preventable disease outbreaks. So vaccine preventable disease outbreaks, if they have started, then we need to not only identify such outbreaks and treat those children, but we also need to carry out something which is called as an outbreak response immunization.